respiratory illness. Right now, fortunately, we are not seeing a huge number of influenza cases. And, that could be due to a couple of reasons. Sometimes flu season really doesn't peak until the first of the year, January, February timeframe. But also, we're hopeful that because of the flu vaccinations and the fact that people are wearing their mask and doing more to protect themselves from COVID, that ultimately is filling the gaps that we typically see with the herd immunity components because of the flu vaccination. Today is definitely an exciting day for public health because the first COVID vaccines are going out today. And Sandy's going to talk a little bit more about those vaccines, and we're learning more every day. The FDA has approved the Pfizer vaccine for emergency use. And it does have a 95% efficacy when this 2-dose series is completed. So that is very, very exciting. But, keep in mind, I think the guidance, people following the guidance, I really think we could be in a worse situation. So I know sometimes the numbers can be discouraging, and we need to take them as fact, look at them to help guide our efforts and remind us to be serious about this response and to take all the precautions that we can. You can see the lab tests. We are seeing a higher proportion of positive lab tests compared to total lab tests. That has increased, and we do think that is due to the higher testing rates that we're seeing just because of the holidays. But we also know that we are seeing more illness, and so we do know that people tend to definitely seek those tests because we are seeing some illness out there. Not seeing quite as much asymptomatic spread, although that still is an impact. The COVID map is something new that the state has put out. So you'll see that in your slide set that you all have. And I know this can be concerning. It is a concerning visual, but one thing that we want to point out for you all is that the state has told us repeatedly, do not use this as the sole source for decision making, particularly for our school systems. Okay, this is one more tool in the toolbox. We need to balance this with everything else that we have, and that decision should be made by the board for the school system in consultation with local public health. And we can say that, we have some misgivings. Again, we see this as a tool. This is one piece to the puzzle. For instance, if you go to the state website and you look solely at percent positive of tests, and you look at that map, there's about 4 or 5 counties on that map that don't even show up because they do not have a high number of tests to be statistically significant. However, that is a component that is factored into these color coding system. So with that, we weight everything. The next slide does show you how these tiers are determined. So they look at the total number of new cases in the past 14 days per 100,000 people. They look at the percent positive, as I mentioned, for the lab test. They look at that hospital impact as well. So that can also be a little bit subjective. With the case rate, keep in mind that's looking at the number of new cases that feed in on a given day. And so sometimes our numbers can be skewed slightly just because of our proximity to Virginia. It takes a little bit of time for those tests to feed in to our system. So that's why we say, let's take this with a grain of salt. Let's really look at everything that we have. Let's look at what's going on in Virginia. Let's look at what's going on in North Carolina. Let's look at our active cases, where our clusters are, where are we seeing our clusters, and all of that together can help us make the best decisions for our communities. The next slide does go through the hospital impact metric and really breaks that down for you. And then this is a great visual, the county metric determination. So essentially what they do for these colors is they look at that case rate. So the number of cases per 100,000. So they do calculate that so that they can get a standard for population for every county. And if you are between 101 and 200, that puts you in the running for orange. And if you're over 200, that puts you in the running for red. Then they look at, and you have to have one of the following, the hospital impact or that percent positive. So again, very subjective when you're looking at all the different pieces. There is some discussion that they are going to look at a green rating as well. So we'll see if that comes out in the next week or two. And keep in mind, if you'll look again at the map, this data is from November 21st to December 4th. And as you can see today, it's what? December 14th. So that's another thing. Technically this is a little old data. They're going to update it every 2 weeks, but again, one tool. And then of course you do have in your slide set the recommended actions based on those color codes for individuals, for businesses, and for public officials. So does anybody have any questions about the data piece? All right, excellent. Well, then I'm going to see if I can share my screen again. Oh, still can't do it. So we'll keep going. I'm going to turn it over now to Sandy, and she is going to give you some additional information from the clinical perspective.
So can they not see the?
They've got a copy of the slides,
Okay.
So they can go along with you.
Gotcha.
We sent that to them early.
Okay, sorry. All right, good morning, everybody. So my name's Sandy, and we're just going to go through some of these little sections that I know you guys know, but it does help to hear over and over, and you guys have the slide set, so I probably won't read all of it word for word, but it is a good refresher. So let's talk about how COVID-19 spreads. Well, we know that it spreads as tiny droplets going in an infected or from an infected person's nose and mouth into one of our mucous membranes. Between people who are in close contact, and the definition of close contact is less than 6 feet for more than 15 minutes cumulatively. And it spread more with forceful things like coughing, sneezing, yelling, singing, cheering. When does it spread? People are most contagious when they have symptoms like coughing or fever, but people can also spread COVID-19 when they don't have symptoms. And another question we get a lot is, can you get it from touching a contaminated object? Possibly if you touch the object and the object's got virus on it, and then you wipe your hands or touch your nose or mouth. So symptoms of COVID-19, I know you guys have heard this 150 million times, but it could be anything from the beginning to end of this list, or maybe just one, or maybe none of them, because we have asymptomatic spread. So they usually appear 2 to 14 days after exposure to the virus, and the symptoms are fever or chills, cough, shortness of breath, difficulty breathing, fatigue, muscle, body aches, headache, a new loss of taste or new loss of smell, sore throat, congestion or runny nose, nausea, vomiting, diarrhea. And like I said, we've seen some people that don't have any symptoms. We've seen some people that have maybe just loss of taste or just loss of smell, or maybe just upset stomach. So that it's hit all of them. Who is at high risk for severe illness? So mainly older adults and people of any age who have serious underlying medical conditions are at greater risk for COVID-19. So people 65 years and older, those who live in a nursing home or long-term care facility, any kind of underlying medical condition, especially if it's not well controlled, including chronic lung disease, moderate to severe asthma, serious heart conditions, those who are immunocompromised, people with severe obesity, which would be a body mass index of 40 or higher, people with diabetes, chronic kidney disease, those in dialysis, or have liver disease. And those are just to name the top ones. So now let's talk about testing for COVID-19. There's 2 types of tests to detect active virus. One's a PCR, which is the gold standard, and the other is the molecular or antigen test.
PCR and molecular.
Oh, I'm sorry. Yeah, I said it. That's 10 o'clock on Monday. So PCR, molecular antigen, and that's the gold standard for detecting COVID. And then the rapid antigens. I don't hear. Am I not reading that right?
So PCR and molecular. So the PCR test is the molecular test.
I'm sorry, y'all.
So that's one and the same. We are up to our eyeballs in tests. But the PCR molecular is what she's saying is the gold standard. So that's the one where they take the swab and they send it off to the lab for processing. It usually takes about 2 days to get back. And then the antigen is the rapid one where they can get the results in about 15 minutes.
Yep. I said my brain and my mouth aren't saying the same thing this morning. Okay, so those are the two types of tests. And so now we need to just review the definition for isolation and quarantine because they're a lot of times they're used interchangeably, but they really do mean two different things. So isolation separates sick people with a contagious disease from people who are not sick. So if I have COVID-19, then I'm going to go into isolation. Quarantine separates and restricts the movement of people who were exposed to a contagious disease to see if they do become sick. So that would be my close contacts, my husband, my children. They would go into quarantine if they're not symptomatic and don't have the disease. All right, so if I'm sick, when can I go back to my normal activities? That's a question we get all the time. If you're sick, then we would have you go into isolation, and you can stop isolating yourself when you answer all three of these questions. Yes. Has it been at least 10 days since you first had symptoms? And have you been without fever for 24 hours without taking any fever reducing medication? And are your symptoms improving? If you're not sure if you have COVID-19, it's always better to isolate as if you do and follow the guidelines. CDC does not currently recommend a second negative test to be considered recovered. Some employers are asking that it's done, but CDC is not saying that that's a requirement. And studies can show that you can present with a positive test and not be shedding virus for up to 3 months. And we've seen that in several situations. Someone's completely recovered, back to work, doing great, and they're still shedding. I'm not shedding, but their tests are still showing positive. All right, so who's a close contact? Like we said before, a close contact is someone who's 6 foot or closer for a total of 15 minutes or more, and that's cumulative time. So that could be 1 minute here, 5 minutes there, 10 minutes there, whatever equals 15 minutes in a 24-hour time period. A close contact could be someone who provided care at home to someone who is sick, someone who had direct physical contact with a person, such as a hug or a kiss, someone who shared eating or drinking utensils, and someone, if they sneezed, cough, or somehow got respiratory droplets on you. All right, so you have been identified as a close contact to a known case. Now what happens? The answer is always you should quarantine. We try to stress that so much, just like with the isolation piece. If you think you're sick, please go home. Please don't stay at work. And the same thing, if you think that you have been exposed, go ahead and remove yourself from the situation. It's going to make everything so much better for everybody. So in the quarantine guidance, in the general community, quarantine can be ended if any of the following criteria are met. And this is pretty new since December the 3rd, I think. So 14 days of quarantine should be completed. That's the gold standard. That's the number one and best way that you can fulfill your quarantine. The second way you can finish your quarantine is if you've done 10 days of quarantine and you have no symptoms, then you can come out of quarantine as long as you continue to monitor your symptoms for the rest of the 4 days. So 10 days, no symptoms at all, and you promise to make sure you pay close attention to your symptoms for the next 4 days. And the third way you can come out of quarantine is if 7 days have been completed of your quarantine and you have no symptoms and you have a negative test. And that negative test has to be 5 days after your last known contact and no more than 2 days from the end of the quarantine period, or 48 hours. So there's a lot of ands, there's a lot of ors in there. So we're telling people, please call us. We keep our little handy dandy calendars with us. Like you find me in the Walmart parking lot, I'm probably going to have a calendar on me because we just get stopped and questioned all the time. So any questions at all, please give us a call. We'll look at the dates and talk through them with you. It's still new to us too. So we're having to think it out and talk it out and count the days. You'll hear us count on the calendar on the phone. If quarantine is discontinued before day 14, the individual must continue to monitor symptoms and strictly adhere to all non-pharmaceutical interventions. So that means they still have to wear their mask, they still have to stay 6 foot apart, and just continue to monitor their symptoms. Any questions about that? We'll stop there for just a minute. Do you see any questions in the chat? Anita's going to check the chat real quick to make sure there's no questions there, but maybe she can get to it. I'm going to keep on going. All right, so next slide is going to talk about illness impact. So I think it's really important to point out that this is not just a short-term respiratory illness, and death is not the only risk of COVID-19. You guys know that Hertford County's had some deaths, but there's still some pretty sick people too that are recovering. This is an inflammatory process, and it affects the blood vessels and many different systems of the body. It can affect the heart, the blood, the brain, the neurologic system, the kidneys. Even in minor cases, survivors of the disease can endure long-lasting symptoms that affect quality of life for several weeks and even months after recovery. We have reports that indicate that some patients are experiencing life-changing symptoms that can become more severe over time, such as neurological complications. So some common long-lasting symptoms that take a long time for people to recover from include extreme tiredness, loss of memory, concentration, loss of smell, loss of taste, sleep disorders, and shortness of breath. 67% of adults with non-critical COVID-19 had lasting symptoms up to 2 months after infection. And 1 in 5 previously healthy young adults age 18 to 34 were not back to normal health even 14 to 21 days after testing positive. So it has taken a while for people to bounce back from this. And number 1, the best way to prevent long-term complications is to prevent COVID-19. So we're going to talk a little bit about vaccine updates. But before we do, anybody have any questions about the disease process, the disease itself, isolation, or quarantine? Good. All right. Okay, so just a couple quick vaccine updates. Moderna and Pfizer have submitted for emergency use authorization approval by the FDA. Final results on efficacy will be determined at that time, but preliminary data is showing 90%. So that's really good. That's really good. Right now, it's only being tested on 18 years of age.
Pfizer has been approved for 16 years and older. Yeah, sorry for that typo on there. Sorry, I forgot that. Yep. That's late breaking news.
I think that just happened.
And initial doses could be released in December. And remember, those initial doses in December are going to be for very specific and targeted populations. Let's see. All right, so the COVID vaccine is being tested. It's appearing to be safe and effective vaccine, and it will eventually be available to all who want it. But of course, at first, as you guys know, supplies will be very limited. The best way to fight COVID-19 is to start with vaccinations for those more at risk, and then reach more people as the vaccine supply increases, and that'll be through 2021, I'm sure. And children will not receive vaccines until clinical trials with children are completed. All right, so your next slide is really busy. I'm going to let you guys read. You don't want to hear me read all of that, but just vaccine development is through a phase process, not just for COVID vaccine, but any vaccine goes through a phase process. It goes through safety and dosing, all the way through efficacy, approval, distribution, manufacturing, and then large-scale manufacturing. The availability, of course, is going to be very limited in the beginning. And then vaccine prioritization. So on that slide, I believe it's slide 29 for you guys as well. There's different colors at the top: purple, blue, green, orange, and red. So you'll see in the upper right-hand corner, there's 1A, 1B, 2, 3, and 4. Those are the designation tiers of who will receive the vaccine. So the first vaccine that goes out will be designated for 1A, which will be healthcare workers fighting COVID-19 and long-term care facilities. 1B is for adults at highest risk of severe illness and those at highest risk for exposure. And there's, if you read under it, it's got all a little bit more. The tier 2 will be adults at high risk for exposure and at increased risk of severe illness. Number 3, students and critical industry workers. And number 4, everybody else who wants it. Any questions about that real quick? And then the last slide I have, I think, is talking about the school antigen testing pilot. So back to that rapid antigen test. NEAT is participating in a pilot with the state right now where schools could apply for a CLIA waiver. A CLIA is a lab-specific certification, basically, for them to be trained and implement standing orders and forms to test on site using those rapid antigen tests. And so that's a current pilot ongoing. I'm very hopeful that this will be moved quickly, just like everything else will, or everything else has, and the school systems will be able to get their own rapid tests. So more to come on that. All right. Thank you, guys.
Thank you.
And turn it over now to Amy Underhill to finish this up. I'll try not to make you all sick while I move the camera. And say hello to Nancy. Let's see. Oh, let me zoom out because you might end up being a little bit close there, Amy.
Yeah, I don't want to be real close. Let's don't zoom in, but so close, right?
All right, there we go. A little closer.
All right, so we're going to just wrap this up and talk a little bit about some of our protective factors that can help reduce our risk. And we mentioned some of these when we spoke with you guys earlier, but we know that general prevention for COVID-19 and any illness that we, are dealing with. So flu, common cold, norovirus, those types of things we see throughout the season. A layered approach is always the best way to handle that. And we do that in several ways. Number one is wash our hands. And we want to do that often with soap and water for at least 20 seconds. I always joke that we're going to just go back to kindergarten with our hand washing abilities. And if you're not sure how long 20 seconds is, just sing the ABCs while you're washing your hands. That's very important. If you can't use soap and water, it's not available to you, using an alcohol-based hand sanitizer is also a good method. Avoid touching our eyes, nose, and mouth with our unwashed hands. Avoid contact, of course, with people who are sick. And that's really why we, honed in on explaining that difference of isolation and quarantine. So, if you're sick, you stay home and you stay away from those that are sick. Covering our nose and mouth with a tissue or our sleeve, not our hands when we, cough or sneeze using another object. And then, of course, if we've used a tissue, throw it away and try to wash our hands or use hand sanitizer. Wearing our face covering when out in public and any time that you're with others that are not in your household. That was part of the mask mandate that came out through Executive Order number 180 a couple of weeks ago, or right there at Thanksgiving, that mandatory mask order. So if you are with someone that's outside of your household, you need to have a mask on. So please keep that in mind. Practicing that social distancing, keeping that 6 feet away. And like I mentioned earlier, staying home when we're sick. And that physical distancing is really, really important. There were some studies done back in the early part of the summer that talked about 3 feet can decrease your risk of spread from 12.8% to 2.6%. But at 6 feet of distance, your protection actually doubles. So again, that's kind of where that 6 feet has come from as well. And, you'll notice, of course, in the Light Our Way and our Strong Schools North Carolina Toolkit, that is why that they were suggesting when you go back to Plan B, that you try to keep that 6 foot of distance, in your classroom with your desk. And then the face coverings as a source control and another layer of protection. Again, a few studies that were done back in the early summertime, talking about a couple of hairdressers who were diagnosed with COVID. They wore their face covering or face mask, and so did the individuals they were providing that service to, and no one contracted COVID. So again, that's showing that layer of protection that we need to have with our mask. And we also know that respiratory illnesses can be decreased by around 20% with the use of proper hand washing. So again, that's why those particular methods have been put into place. Some other key research. So the risk of infection if exposed by someone with COVID-19 is decreased by 85% with social distancing, 77% by always wearing a mask, 76% by the duration of contact less than or equal to 15 minutes, and 67% by frequent hand washing. So, when we combine all of those together, we are, again, putting those really tight layers of protection against COVID. A couple of other key research updates that I think have come out since we have had the chance to review this information with you in the past is that they have found that children and adolescents younger than 20 had a lower susceptibility to COVID infections than our adults, and that susceptibility seemed to be much lower in our children that were younger than like 10. Those older adolescents, like 10 and up, were actually pretty, there wasn't a lot of significant difference in the infection rate than adults. So that's one of the reasons why Governor Cooper let the schools go back to Plan A, with letting those elementary school kids go back in person more often because of some of that scientific data that's been showing up. And we've referenced that information there so you can take a look at the full study as well. There was some other studies done during March 1 to September 19. Again, this was kind of a small sampling of children, but they did notice that the incident among adolescents aged 12 to 17 years was approximately twice that in children aged 5 to 11. So they saw that incidence in those older adolescents was higher as far as them having the incidence of COVID versus our younger kids. But we did see that some of those children who had those underlying health conditions had more severe outcomes related to COVID-19. And again, we've referenced that before, that individuals who have those comorbidities and some of those chronic illnesses certainly are at more risk of COVID as well. So again, we've linked that particular information from the CDC, so you can take a look at that as well. Any questions about that part? And we just want to remind you that we have that our health departments are open for vaccines. So flu vaccine is still available. We also have the flu vaccine available for anyone who is underinsured adults or uninsured adults, uninsured children. We're able to provide that flu vaccine now. So keep that in mind. And we also know that some of our kids hopefully will be heading back to the classroom. So they need to make sure they're meeting that requirement for the state of North Carolina to have those recommended vaccines that they need before entering back into the classroom. So those 6th grade shots and your kindergarten shots and those types of things. So the health department is available for that. And then we also still have our COVID testing as available at the local health departments as well. So just keep that in mind. So thank you.
Great. We do have, I saw one question in the chat. So it says, are you seeing long-term symptoms in children who have tested positive? And I think we really have seen mild illness for the most part in children. Not, I think it kind of goes to what Amy was saying, that those children who do have really severe underlying conditions obviously are at more risk. But for the most part, we are seeing more mild illness in children. And speaking of that, I did want to mention that Amy noted those studies on the children. And so just to kind of relate that to our district and our numbers. So in northeastern North Carolina, for our 8-county service area, children aged 0 to 17 make up about 20% of our population. However, for our total cases that we have seen so far, they only make up about 8%. So you can see that we really are seeing the cases in our older populations, much to what we're seeing nationwide with a lot of these studies. So I think that really does demonstrate what we're saying, that the community spread, we're seeing in our schools what we're seeing in the communities, just because, you know, it's not like they just go to school and nothing else. But we are not seeing the clusters and the EpiLink cases in the school systems. Our schools have done a phenomenal job of really trying to maintain that 6 feet of social distance. I think that is absolutely the key piece right there. Maintaining and making sure that those cleanliness strategies are in place, this hand sanitation, and of course those face coverings are very helpful too. So that's all we have for you all. Any questions for us?
Mr. Dennis Deloach, I have one question relative to what you just said and what Amy was talking about the school system. You indicated that the spread was not really significant in the school system. Is that because in the public school system, how many systems do we have that are actually in operation today? How many are having face-to-face? Because, you know, when you talk about the numbers, are we talking about numbers to a small cluster, or are we talking about numbers to a larger group? Can you talk a little bit about that? Can you talk a little bit about that and what's happening in our public school systems? And now I know we got private schools that have already started, and I know you can't get into personnel information, but we need to know what's happening in the schools that are already taking place.
Yes, absolutely. So what we have seen is Perquimans County schools, they started first with in-person learning. They actually started back in August. And so when Plan A was allowed, they expanded a little bit further for the K through 5. And so they are Plan A for K through 5, and then Plan B for everybody else. So all the students are having some in-person learning. They've done a great job of communication. They do alert everyone. I'm actually a Perquimans County parent, so I get those phone calls whenever they have a case. But we have had no EpiLinked cases in the Perquimans County school systems. Chowan County was next. They are face-to-face, much like Perquimans is. And again, we have seen some cases there. Again, nothing really EpiLinked across the schools and then within the classroom, but more community related. I believe the next school systems that came in session were Camden and Pasquotank. So they have started some in-person learning there. And have done a great job as well. And I think what we have seen is, like, for instance, I know Perquimans, Chowan, Pasquotank, they've all hosted. It seems like they work very closely together. So I know that they would be more than willing to open their doors to talk a little bit more with you all about what they're doing and how they're responding and share their letters and everything. Camden is doing a great job. I think really what we are seeing across the board, and then Currituck, I think we have seen a little bit more activity in Currituck, but just because they had some cases on their buses, and it's hard to really socially distance those cases. Anecdotally, and we will not call out any school systems or private schools, but I think we can certainly see the difference in implementing the guidance of social distancing, hand washing, and cloth face coverings. They really do make a difference. When you can enforce those regularly, we are simply not seeing the clusters. If you do not, that is when we see the clusters. Do you all agree with that statement? So I'm not going to call any names, but I think that is, we can certainly see that. So summary: Currituck, Camden, Pasquotank, Perquimans, and Chowan all now have some sort of face-to-face capacity. Our individual health departments work very closely with those school nurses, and the school nurses are the rock stars in this pandemic. They get the guidance, they understand the guidance, and they are communicating with our health department staff so we can make sure that we're right in sync and in tune.
Okay.
But I know Gates County is planning to go back in January.
They are, okay. One other question: you see our data, looking at the COVID map, We were in the mid zone the last time, I believe. I think we were in the orange zone, and now we're in the red, which is critical. I'm glad you said that that was not a determining factor that we needed to look at when trying to decide whether to go back to school. But it is a factor that it is something we need to look at.
Correct.
I agree. Thank you so much for that. Board members, do you have any questions at this time?
Yeah, I think that map is definitely, look at all the data. If you have more specific questions, about Hertford County, please send them our way and we can break it down for you a little bit more. But understand, we have seen quite a few long-term care facility outbreaks in Hertford County, and that has drastically impacted your numbers.
Yes, yes.
We are not seeing the child cases. I'm looking at our clinical team to make sure I hadn't missed something. We're not seeing really the child cases in Hertford County. We really have seen those clusters within those outbreaks within the long-term care. And they do not differentiate that. So if the majority of your cases are coming in, like I'm going to use Currituck, they have a big outbreak. So we're seeing Currituck numbers drastically increase right now. But that is because of a long-term care facility. It is not really the community piece. And so you'll notice in our press releases that we do on Fridays, Amy puts in the press release the breakdown of the long-term care facilities as well. So that information plus the number of active cases along with the map, that can really give you a more complete picture.
Thank you. Board members? Any other board members have any questions? If not, on behalf of the Board of Education and all of us, we certainly want to take this time to thank you for coming to share this information with us. We know the numbers in the state of North Carolina are going up. In the country, the numbers are going up. In our county, they're going up. They're going up all around us. But we feel like the more information we have, the better decisions that we can make for our children and our staff. So thank you for your time. Thank you for your energy. And thanks for all that you do for all of us.
Absolutely. It is our pleasure. We are always here for you. We really value your partnership. So whatever you decide, we're backing you 100%.
Thank you. Board members, any comment? All right. Thank you so much.
Thank you. Y'all take care.
Bye-bye.
All right. Okay, any discussion on this before we go into closed session? If not, I'll entertain a motion that the board go into closed session. So anyone?
Make a motion that the board goes into closed session.
Mr. Chair, I second that motion.
And motion that we go into closed session, probably in second. All in favor, say aye.
Aye.
All opposed? So motion. So we'll go into closed session in just about a couple of minutes. Thank you.
Mr. Eddie Hall is a newly elected board member that will also be sworn in this morning. So at this time, I will turn it over to Judge Branch.
All right, thank you. And thank you all for having me. I appreciate your calling. It's never a bother. I'm excited for all of you who are about to serve. And so with that being said, Mr. Wendell Hall, and I see now, Mr. Eddie Hall, your first name is Clarence, is that right?
Yes, ma'am.
Okay, so it's Clarence Eddie Hall III. Now, normally I can have you repeat each word, or I can read the oath and you can affirm and say, I do. Is that preferable to you, Mr. Wendell Hall and Mr. Clarence Hall?
That's fine with me, Judge Branch. That's fine, Judge Branch.
Okay. All right. Then I see you have someone to hold the Bible for you, Mr. Clarence Eddie Hall.
Yes, ma'am.
Okay. So you're new, so we're going to get you first, and we'll come back to Mr. Wendell Hall. Is that okay, Mr. Wendell Hall?
That is okay.
All right, then let's let Mr. Eddie Hall have his first time himself with his son holding the Bible for him. So if you will, place your left hand on the Bible and raise your right. All right. And since this is your first time, will you please repeat after me? I, Clarence E. Hall III, do solemnly swear that I will support and maintain the Constitution and laws of the United States and the Constitution and laws of North Carolina, not inconsistent therewith, and that I will faithfully discharge the duties of my office as a member of the Board of Education for the Hertford County Public Schools, and that in the discharge of said duties, I will fairly and diligently consider all issues coming before the Board of Education, so that every student is provided with the equal opportunity to learn, and so that each school provides an environment in which every student is encouraged and can reasonably be expected to realize his or her maximum educational potential.
Could you repeat that again, Judge Branch?
Yes. An environment in which every student is encouraged
An environment in which every student is encouraged
and can reasonably be expected to realize his or her maximum educational potential without regard to their or my place of residence within Hertford County. So help me God. Congratulations. This is sworn and subscribed before me this 14th day of December 2020, and I will sign and have a copy in Hertford County on tomorrow.
Thank you, Judge Branch.
Congratulations.
Thank you.
Congratulations to your family.
Thank you.
Thank you.
It will require much work, and we appreciate you.
Thank you so much, Judge.
All right. And Mr. Wendell Hall.
Yes, Judge, I'm here.
All right, then. Now, you have sworn before, and so I'm just going to ask you to say I do. Is that okay?
That's fine with me.
All right. Then, do you so swear that I, Wendell J. Hall, do solemnly swear that I will support and maintain the Constitution and laws of the United States and the Constitution and laws of North Carolina, not inconsistent therewith, and that I will faithfully discharge the duties of my office as a member of the Board of Education for the Hertford County Public Schools, that in the discharge of said duties, I will fairly and diligently consider all issues coming before the Board of Education so that every student is provided with an equal opportunity to learn, and so that each school provide an environment in which every student is encouraged and can reasonably be expected to realize his or her maximum educational potential without regard to their or my place of residence within Hertford County. So help me God. Do you so solemnly swear?
I do.
Congratulations. This is sworn and subscribed before me this 14th day of December, and I will have a copy in Hertford County on tomorrow just for you.
Thank you, Judge.
Yes, sir. You're welcome. Congratulations.
Thank you.
Congratulations, Hertford County School Board. Anything that I can do and anytime I can be of service, please feel free to give me a call.
Thank you so much.
Thank you so much.
Yes, sir. Thank
Judge
you,
Branch.
Superintendent Wright. I'm still here if you ever need me.
Thank
Judge
you
Brandt.
very much. We're gonna take you up on that too.
I will.
Judge
All
Brandt.
right.
Judge Branch, we really want to say thank you so much for your time and for your patience. We know you were on standby. I said to the superintendent, I said, what time is the judge going to be on standby? Because I didn't want to keep the judge waiting too long. We do apologize, but thank you for your time. Thank you for your patience, and thank you for coming out and doing our installation.
It's not a problem at all, anytime, and you know, things come up, and so I don't feel put out at all. Thank you all for serving. Have a blessed week.
Thank you, ma'am. You too.
Yes, sir.
Okay. First of all, we want to congratulate both Mr. Hall, Mr. Wendell Hall, and Mr. Eddie Hall. Mr. Wendell Hall needs no introduction. Mr. Eddie Hall is to the board. As you know, he's a former student and a teacher here in our system, and we look forward to working with both of them. At this time, as you know, during the year, each year, the board comes together to reorganize. With that said, I would like to turn the meeting over to our superintendent so he can conduct that part of the service. Thank you. Mr. Superintendent. Dr. Wright.
Okay.
Anybody?
Can you hear me
Everybody?
now?
Yeah, I can hear you. Can you hear me?
Yes, sir. Yes, sir.
Okay. We just turned this, the meeting over to you to do the reorganizing.
Yes, sir. I heard it. I was muted, I think. But everybody can hear me now.
Yes.
Yeah.
Yes.
Yes.
Very good. So as Mr. Deloach has just stated, each year in December of the school year, the board selects officers for the upcoming calendar year. These officers are based on calendar year more so than being in congruence with the school year. And so at this time, I would like to open the floor for nominations for chairperson of the Board of Education for the 2021 calendar year.
Dr. Wright, I would like to nominate Mr. Deloach at this time.
Ms. Porter and board members, I thank you for that. I'm so grateful for you. I've got some personal issues that are coming up, and I'm not going to be able to serve in that capacity at this time. But thank you so much.
You're welcome.
Dr. Wright, I'd like to nominate Ms. Sheila Porter for the chairperson.
I second that motion.
Are there any other nominations for the chairperson? Okay, hearing none, we can close the floor with one said nomination. And so we do not need a vote, but I would like to ask if all those in favor of Mrs. Sheila Porter being the chairperson for the 21 calendar year, please signify by aye.
Aye.
Opposed? Congratulations, Mrs. Porter. Mrs.
Thank
Porter, depending on whether you have the agenda in front of you, I can certainly work with you on the next items if you need me to. Just direct me however you want me to do that.
Yes, I need you to work with me on the next items.
Okay. So the election of the vice chairperson is next.
Okay, at this time, I would like nominate persons. This time we are going with the election of the vice chair at this time. Are there any nominations?
Mr. Deloach, Madam Chair, if I may. Does
Yes.
your statement include serving in any capacity or just the
No, Ms. Shields, it's just the chair position at this
Wendell?
time. Mr. Hall, yeah, it's just the chair position at this time. I can serve in any capacity.
I make a motion then, Madam Chair, if I'm in order, I make a motion that Mr. Deloach name be put into the nomination for vice chair.
I second that.
All in favor?
Aye.
All opposed?
Aye.
Motion has been passed to accept Mr. Deloach as vice chair for Hertford County Board of Ed.
Thank you.
Thank you, Mr. Deloach, for accepting.
Yes, sir. Yes, ma'am. I'm sorry. Thank you so much. I'm sorry. You see,
And
this
I
is
told
confusing
either
already.
one of you were what we got to do over that 12 months.
Miss
Telling you.
Porter,
Thank
Miss
you
Porter,
so much.
you see this is
Yeah,
confusing already.
I've got to get it together for a minute.
Together now.
Just bear with me for a minute. At this time,
Madam
may
Chair,
I have, yes,
Madam Chair, our next item on the agenda is acceptance of the agenda for the last board meeting.
may I have a motion at this time to accept the agenda?
Madam Chair, I move that we accept the agenda of our last meeting.
May I have a second?
Second motion, Dennis Deloach.
All in favor?
Aye.
Aye.
All opposed? Motion has passed.
Madam Chair, members of the board, our next item on the agenda is bulletin board description. Mrs. Brunette Parker.
Members,
Get some more mics.
members, Dr. Wright, this month, December, the bulletin boards were done by Hertford County High School, Principal Ernest Cooley. The boardroom boards creators were Rhonda Lee, the high school teacher of the year, Doris Harmon, retired teacher and substitute, Tequila Powell and Joan Lindsay, they were bus drivers, Tony Hunter and Randy Beal, instructional partners. This month's boards were geared to the holidays. The one in the hallway stated, "A good education is the greatest gift you can give yourself or anyone else." The one in the boardroom, "This Christmas, we don't need more stuff. We need high school a hand for two beautiful boards." Thank you.
Thank you, Ms. Parker. The boards were very beautiful. Would like to thank those involved for taking their time and dedication and the words of encouragement that are placed on the boards for this holiday season. Okay, next, may I have a motion to approve? Is it certified personnel, Dr. Wright?
We're not
Oh,
quite
we
there
are,
yet.
I'm jumping the gun there. What
Consideration of
about the minutes for November?
Yes, ma'am.
right.
May
Madam
I have,
Chair,
yes,
Madam
ma'am.
Chair, I like the motion that we approve the minutes for November the 23rd, and that they reflect the comments that were discussed in closed session, should they not be there.
Okay, thank you.
Second that
May
motion.
I, all in favor?
Aye.
Aye.
All opposed? Motion has passed.
Madam Chair, the next two items are public input and the 5-minute recess.
Ms. Parker, is there any public input?
She's saying no, Madam Chair.
Thank you.
Okay.
And we will move on.
Okay, our next item on the agenda is 4.1, which is personnel, Mrs. Cherry.
4.1, retirement, resignation, and transfers. You have the information there before you.
Are there any questions? Concerns? Okay, Ms. Cherry.
4.2, certified classified recommendations. We have Michael Norman being recommended for the CTE STEM teacher position at Hertford County High School. and Brianna Marshall being recommended for the school counselor at Hertford County High School. And those are certified classified recommendations.
May I have a recommendation at this time for certified personnel? A motion to approve.
Madam Chair, Dennis Deloach, I motion that we approve the certified recommendations being coming from the administration.
May I have a second?
I second it, Madam Chair.
Questions? All in favor?
Aye.
Say aye. All
Aye.
opposed? All opposed? Motion is passed.
4.3, additional employment. We have Quashandra Downing being recommended for additional employment for child nutrition, and Sandra Deloach being recommended as long-term substitute teacher at Early College High School.
May I have a motion at this time to approve the additional employment recommended by administration?
Dr. Sharon, Madam Chair, I make a motion that we approve the additional employment recommendation coming to us from administration.
Are there any questions or concerns? May I have a second, please?
Dennis Deloach, second motion.
All in favor, say aye.
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 All
Aye.
opposed, nay. Motion has been passed to accept the additional employment coming from the administration. Ms. Cherry?
This particular plan is a requirement of the state, and it outlines how Hertford County Schools will be providing support to beginning teachers in the form of mentors, mentor training, monthly meetings, and any compensation for mentors and training. That's our beginning teacher support plan.
May I have a motion to approve the administration's offer?
Dr. Sharon, Madam Chair, I move that we support the Hertford County Public Schools beginning teacher support plan as presented to us by administration.
May I have a second?
Second.
Are there any questions? All in favor? Aye.
No question.
Aye.
Aye.
All opposed? Motion has passed. Mrs. Cherry?
Item 4.5, position request change. We are requesting that the federal programs compliance officer position be changed to an EC program specialist / pre-K monitor position.
May I have a motion at this time to approve the position request change by the administration?
Madam Chair.
Madam Chair, Dr. Sharon, again, I move that we. Go ahead, sir.
No, go ahead. You good? Go ahead, Reverend Sharon.
Madam Chair, I make a motion to approve the position change coming to us by administration.
May I have a second?
Second motion.
Are there any questions?
Yes,
No
Madam
question.
Chair. One concern, Ms. Cherry, I want to make sure that this position is being paid by the grant. Is that correct?
position is being paid from federal funds, federal EC funds.
Right, okay, thank you. Thank you, Ms. Porter.
Thank you, Mr. Deloach. Miss Cherry, do you have anything else for us at this time?
My last item for today is the Global Teaching Partners contract. This contract is for us to partner with global teaching partners to provide us with visiting international faculty. They would be certified teachers coming with experience in teaching and will enable us to hire certified teachers for our students. And they will be here on the J-1 visa.
Okay, may I have a motion to approve the Global Teaching Partners contract at this time?
Madam Chair, Wendell Hall, I make a motion that we approve the contract between the International Visitors Program and Hertford County Public Schools.
May I have a second?
Madam Chair, I second that motion, James Sharon.
Are there any questions or concerns? Motion has passed. Was that your final,
Yes, ma'am.
Ms. Cherry?
Yes, ma'am. Thank you.
Thank you so much for your information. Okay, guide me on, Dr. Wright.
The next item on the agenda is Superintendent's report. So Madam Chair, members of the board, if you're ready for that, I can begin.
We're ready.
Okay.
It was gonna be short.
Yes, sir.
I didn't hear that.
I'm sorry, I should have said that.
First on the highlights, I'm asking that you join me in sending our deepest sympathy, thoughts, and prayers to the Langford Cherry family for the loss of Latoya Cherry, Langford's father, Tony Cherry. On Friday, he was a past employee of the Transportation Department of the Hertford County Public Schools. And further information will be forthcoming once we receive that. We'll make sure to get that out to the Board of Education. Also, I've got an example right here of a mask that was donated to us by, yeah, you want to zoom that in? Is that what you're going to do? Okay. All right. It was donated to us by Vidant Hospital. There will be, they have given us about 600 plus of these that will be distributed to employees. Is that right, Mrs. Parker? The beginning of the school year. So they'll be coming out to employees in January. But on one side is our beloved Hertford County Public Schools crest. And then on the other side, you will see Vidant's logo and their regional hospital. We're certainly excited about that. Superintendent's wearing one today. And throughout the Christmas holidays, I'm cheating a little bit, but the rest of the staff will get theirs in January. And we're looking forward to that. And we thank Biden, of course, for agreeing to provide us with these masks. Now, student masks, whenever we return, those have already been put in place. We have those available for students should they need them, courtesy of the state. Also, a couple of other things. C.S. Brown High School STEM, Thursday, December 3rd, they had their ACT Work Keys test. 8 of the students received gold, 7 silvers, and 4 bronzes. All of those were received from C.S. Brown High School STEM on that date. The ACT NCRC, which is based on ACT Work Keys, research-based skills assessments. That's what they took and so forth and so on. Okay. Also, from the Curriculum and Instruction Department, we have begun work keys testing at our other schools. And we know right now that about 88% of the students that we were supposed to test have actually tested. And that's been done. So we're waiting on the results from our other 2 high schools. Also, today is day 1 of EOCs. Hertford County High School only is testing today. And so far, we've got about a 53% participation rate in testing for today, about 61 students out of 116. The bulk of our EOC course offerings, as well as testing, will take place second semester. The board might remember we on purpose kind of did that because the second semester will be a little bit longer. And so we felt like our students would be served better if our EOC, most of our EOC courses would be second semester. The last thing that I would say while I've got the floor, Madam Chair, members of the board, if I might, we are approaching the holiday season, the Christmas and New Year season. I absolutely implore all of us to make sure that we remain safe. I heard a statement this morning on the way in I thought was pretty appropriate. And the person said, as much as we would love to gather and everybody's anxious about gathering and giving everybody a hug, you know, it is better to delay those hugs and those in-person visits right now so that we'll get the opportunity to do that for many more times. So my imploring to our staff and our students and our community that's listening, the very most important thing of all is that we all remain safe. Everything else can be deferred and delayed, but not denied. If we're not safe, then we stand a chance of not being around to be able to enjoy our future life. So whatever that means, it means wait, wash, and wear. But it also means being smart about communication. We've got these things where we can call people, we can video people, whatever it is that we need to do. And you know, as a superintendent, I'm not in a position to demand that anybody do anything, but I'm asking you to just be safe and be cautious about the things that you do moving forward, particularly in this pandemic, because it has not gone away. It is not going away. It is here. It is something that can be caught if we're not careful. That's all I have, Madam Chair.
Thank you, Dr. Wright. Mr. LaLoach, any comments?
Yes, ma'am. Thank you, Ms. Porter. First of all, I want to wish everybody a Merry Christmas that's coming up, and remember that as we celebrate, we need to remain safe, as the superintendent said, but also as we celebrate, let's remember the reason for the occasion as well. My condolences also go out to Mr. and Ms. Langford on the loss of their father and father-in-law, Mr. Tony Cherry. I've had the pleasure of working with Mr. Cherry. He was an excellent person and an excellent friend, and we certainly send our condolences out to him. We want to thank Valiant also for their support with the mask, but I think they're also sending us a message. They want us to carry this message to make sure everybody began to wear masks. So we certainly appreciate their support and what they did. Ms. Porter, I just want to bring one issue. Do we need to, in open session, inform the public the decision that was made about school and athletics, Mr. Superintendent, Ms. Porter? I think the superintendent.
Mr. Superintendent?
Right. I think he can update the board.
Because we did have a meeting. I think the public needs to know we have met with Albemarle Health, and that Mr. Superintendent, would you like to share at this time?
Yes, ma'am. I'll be glad to, Madam Chair, members of the board.
Thank you.
So the Board of Education, after hearing information from the Albemarle Regional Health Services, as well as information that we were able to provide them from the survey information that we have so far, the Board of Education has made a decision to continue with all student learning being on Plan C until January 25th, 2021, at which time the Board of Education has a meeting to determine the future attendance for students. So as of right now, we're still on Plan C beginning second semester, January 4th. We will continue that through the board's next meeting, which will be on January 25th of 2021. The board also had deliberations and made a subsequent decision about athletics upcoming this year based on parent wishes and with parent permission. The board will allow for athletics to for basketball practice to begin as of tomorrow, December 15th. And that practice will be in preparation for the basketball season to commence on January 4th. All of this is contingent upon following of CDC, DHHS, and NCHSAA guidelines. All of that information is to be strictly enforced and approved by parents who are allowing, families who are allowing their student athletes to participate. The board is very, has been very adamant about the fact that there's a clear expectation, as well as mine, that our student athletes follow strict guidelines in terms of all of the requirements that have been put forth by those three agencies. Is there anything else I needed to go over, Madam Chair?
Not that I can think of, but other board members, would you like to question, concern? Any more questions or concerns for Dr. Wright at this time? Thank you, Dr. Wright.
Madam Chair, members of the board, we will communicate all of that information on our my technology staff. I'm sure because of the equipment that's in the room, we'll get something videotaped like we did before, and get that released really soon here out to the staff, so that the community will know our plans for continuing on Plan C, at least in the immediate future.
Thank you. I think that will bring clarity to our parents, and they can understand from you what we have decided to do. So thank you so much. The sooner the better.
Yes, ma'am.
Okay. Mr. Sharon, comments?
Thank you, Madam Chair. Let me commend you for being our new chair for the year. Congratulations to you. I want to congratulate Mr. Eddie Hall for being a new member on our board. I'm looking forward to working with him in his new capacity. Congratulations to Mr. Wendell Hall for being sworn in again to work with us. We're looking forward to that relationship. Just look forward to working the new year. Let me just say that I do share condolences with the Langford Charity family and the Travis Moore family. They have our prayers and our condolences and thoughts. I thought Mr. Shields would be here today, and I just let him know that I've enjoyed working with him the past 2 years as well. I want to say thanks to Ms. Ashley Stoops and the people that came today to inform us from the Evermore Regional Health Services. As you all saw in those charts and those reports, things aren't getting better with COVID. And our job is to make sure that our children are taken care of to the best of our ability. So I want to thank the board for working and everything that you are doing and working with our superintendent, his staff, and trying to do everything that we can do to help protect our children and our teachers. So let's continue to work together and do those things that we swore to do when we were sworn in. Mr. Superintendent, I saw that you were nominated for the North Carolina State Superintendent by the NERESA. Congratulations to you. I think that was all I jotted down. I want to say to everybody, be safe. COVID is not a respect of persons. things are getting worse instead of getting better. Glad to know that they've got a vaccine that's out there and then it's been approved. So hopefully the year 2021 will be a better year when it comes to this virus. I want to wish everybody a Merry Christmas and a safe and prosperous Christmas holiday. Let us continue to abide by the regulations that are laid out for us so that we can stay safe and we can keep our families safe. Merry Christmas and have a safe and happy and prosperous New Year.
Thank you, Mr. Sharon. It was also shown this morning where in New York, the nurse was the first person to get the vaccine. I'm sure you'll see it a number of times because it was on CNN today. Thank you so much. Now we'll move to Mr. Eddie Hall. Mr. Eddie Hall, congratulations. We are glad to have you on our team. And we wish you so much success. And you will see how great this board is working together. Because one thing we do, we don't rush anything. We know that our job is here for our students. We want to make them the best, the brightest, and the healthiest in the world. So I am sure that you will come in, you will enjoy, we will enjoy you, and we just congratulate you today for taking your oath. Do you have any comments at this time?
Yes, ma'am. Thank you, Madam Chair, and to the fellow board members and Dr. Wright and your staff. Thank you all so much for your warm welcome. I'm certainly excited on this new venture that I'm taking on and working with you all as our Board of Education for the betterment of our students and our staff and parents in our community. Would like to send my condolences to the Langford Cherry family on the passing of Ms. Langford's father, as well as to the Moore family for the passing of one of our former employees, Mr. Travis Moore. Just want to wish a Merry Christmas to all of our students, staff, and our community, and remember to stay safe during this time. And I look forward to working with the members of the board so we can better move Hertford County forward the way it needs to be and stay safe at the same time. Thank you so much, Madam Chair.
Thank you. Mr. Hall, your final. We would like to, but we aren't gonna let you off that easy because I did not forget that we always look forward to your updates from the state board. But I would also like to congratulate you also for taking your oath for a number of times. I can't quite remember now, but you do. So we would like to congratulate you on your oath of office again this time. And may we hear from you also, Mr. Hall, concerning the state board.
Yes, ma'am. Thank you, Madam Chair. And I would like to combine those two together, if I could.
Sure.
The state board, of course, met a couple of weeks ago in our monthly meeting. And the big issue now with the state board is putting together our budget for the new General Assembly that's coming in. And one of the biggest areas now that really is under concern from all, after hearing information coming from the health department in Raleigh, is the mental health of our students and our staff. There will be lingering effects upon our student population after being out for 9 and 10 months of person-to-person contact. But I do want to emphasize one point. Sometimes when we talk about school not being open, school has not been shut down. School has not been shut down. We just have gone a different way in delivering the curriculum from March until now. So we still have school, but we just have it in a different format now. And that is something that we wanted to make sure that our parents and others fully understand. The big thing now, and Dr. Wright, I want to go back to your EOCs. The testing that's going, our EOC testing that's going on right now. That's a big issue between the state board and the present State Superintendent Johnson. Is that 20% rule that's in there. And some people believe that the rule has been eliminated. It shouldn't be in there. It should go through the rule-making procedure. But the 20% was put in years ago to entice students to take the EOC. Why? Because the feds have a 95% rule. And if they don't meet the 95%, we don't meet the 95% testing rule, then the Fed comes in with a whole lot of questions as to why not. So, but the 20% was put in to entice kids. Now, to take the EOC, in order to take the EOC now, it has to be in person. Now, Dr. Wright, you mentioned a minute ago that we had 50% to show up for the first testing of the EOCs. And that was face-to-face, am I correct? Or on-site?
Yes, sir, that is correct. Yes, sir.
Did we transport those kids or did they come on their own?
We offered transportation, so those that needed transportation, yes.
Okay. Well, the second half of the testing is in spring, am I correct?
Yes, sir, that's correct.
The state board, let it be known that the state board has said also that a school system can ask for a waiver to do testing, EOC testing, up until June.
Yes, sir.
And hopefully by that time, this virus, this pandemic will be under some type of control. They don't have to come right now to take the test. And some people believe that we're making them come to school. That's not the case.
No, sir.
The state board has asked the federal government for a waiver on the 95% rule and on the accountability side of it that we might be able to get from them. Now, we don't know whether we're going to get it or not. We have a new Secretary of Education that'll be named soon because DeVos is leaving. But we know they have not granted any waivers to any other state as of today. But that waiver will help us with the 95% rule as well as the 20% issue. But until we get that waiver, the state board is not changing at this point in time. So, but that second half of the year, Dr. Wright, right now, testing is going to have to equal to 95%. Am I correct?
Yes, sir. That's correct. Yes, sir.
Okay.
And we've asked, we had the paperwork ready to ask for that same flexibility to be able to test all the way.
Good enough. Do get it in,
yes,
just
sir.
in case.
It is. It's already on the way, or
Okay.
it is on the way. Yes, sir.
That is great.
Yes, sir.
As a state board member, I'm also seeking once again information on the new social studies standards. As you well know, we're looking at changing the social studies standards for the 21-22 school year. And I've spoken to Mrs. Ward, but I haven't gotten back to her about the social studies standards. But if anybody has any input at all or want to have input at all in the new social studies standards, please call me, give me some feedback, because we're going to probably talk about it more, we the state board, in February as we move forward. And it's important that all groups are inclusive in the new standards, who went about developing this great country and having it become what it is today. We want to leave any group out. I'm going to encourage our board to look at an equity policy. I'm going to say it again. I'm going to encourage the Hertford County Board of Education to develop an equity policy to put in force in Hertford County. And equity truly means opportunities for all. That's what we're talking about. Opportunities for all. The other thing that the state board is concerned about, and Mr. Superintendent, I know you are, is providing services to our exceptional children population.
Yes, sir.
Are we doing it? Are we doing it with fidelity? We need, those children need to be afforded the same opportunity that they had if we had face-to-face. Do we have any face-to-face, Mr. Superintendent, with our EC population?
No, sir. No, sir.
All of it's done virtually.
Yes, sir.
Okay.
Or paper packets.
Yes. Well, let's make sure that all kids are afforded. We need to make sure as a board that all kids are afforded that opportunity. Because if not, then we are denying a child a free, appropriate education. And that can cause real problems down the road for us. Mr. Superintendent, last time we were together, you were going to share with us the number of students that attend our public charter schools from Hertford County to see if that number matches the number in Raleigh. Were you able to do that?
I don't know that I have the exact figures. I will get those and share them to you. No, sir.
Well, it's important for those figures
yes, sir,
to match what is being said in Raleigh. That is correct.
Yes, sir.
Especially if you're in a rural system. I know one system right now is $900,000, and you know that's where it is. The state board will be dealing with new charters coming on board in the near future in providing services to children who are in need of a different type of education, maybe. With that being said, I think that's enough today, but that, Mr. Superintendent, you received, I think I saw Mr. Deloach smile, but you received that letter that came out the weekend.
Yes, sir.
And apparently Mr. Deloach knows about it too.
Oh, yeah, we got it.
Well, even with that being said, understand what the letter said, and I'm gonna leave it at that. The response, as well as what was said from the superintendent. And we look forward to the new superintendent, Truett, coming on board and being a part of this this program to educate all children with fidelity and offering opportunities for every child. Remember, in North Carolina, there are 1.6 million K-12 students. And I got to say this, and they don't all play sports. So we don't want that to be the driving engine for our education of all students. Once again, I want to offer my condolences from my family to those employees who have lost loved ones here recently. It's been a tough 2020 with us, with the COVID, and of course with other individuals going on to the final resting place. But I do offer my condolences to all. I wish all a very Merry Christmas, Happy New Year, and be safe. And I look forward to seeing everyone on the 25th of next month. Thank you, Mr. Chairman. Thank you, Ms. Chairman.
You're welcome.
And Mr. Deloach, thank you for your leadership thus far as we went through this trying times. It's tough. And by the way, fellow board members, there are no answers. There's no playbook. We just have to work together, make the best decision we can, and move on with that decision. Thank you, Madam Chair.
You're welcome, Mr. Hall. Thank you for so much irrelevant information. You know, it's so great to have a state board member on the board at Hertford County.
Amen.
So that we can get firsthand information for what's going on. And one that's so dedicated with the children in our county and getting this information to us. So thank you, Mr. Hall.
Thank you, Madam.
Are there any questions for Mr. Hall at this time?
Madam Chair, I have one question. Mr. Hall, are you saying that we do not have an equity policy in Hertford County?
I don't know of one. If it's there, I just haven't seen it.
Okay, okay.
But that's a good question for the superintendent.
There is not an official policy in place. We of course are, under EEOC and all of that, but in
Yeah, but
terms
this
of
is
a policy,
different.
no, sir. This
Yeah, this is different. And
this
that is something that the board can work with the superintendent in developing it.
Yes.
Okay.
But that's my recommendation, that we have an equity
I
policy.
think it's a great recommendation, Mr. Hall, because I did that class when we had the conference, and it was one of the classes I took, and it was very interesting. And I was going to ask to see that policy just to kind of read over it.
Mhm.
But now that I know we don't have one, you're exactly right. We need to get one.
We need to have one. Yeah,
Exactly.
absolutely. Thank you, Madam Chair.
You're welcome. Thank you.
Madam Chair,
Yes.
if I might, before we go any further, in my superintendent comments, I failed to mention, certainly not because of intent, but I just overlooked it. Mr. Travis Moore, of course, passed away
Yes.
at the beginning of the month, and I actually got an opportunity to go over and spend just a little bit of time, of course, social distance with the family. Take this point of preference to congratulate our Mr. W. Hall, who was re-elected to the Board of Education. Look forward to continuing working with him, as well as Mr. E. Hall, who has joined the board. And I don't know if the board members have thought about this, but certainly for the first time during my tenure here as superintendent, all 5 of the board members that are serving on the board now are graduates of the Hertford County Public Schools. So I think that's a commendable thing, and look forward to continuing to work with you.
Madam Chair,
Yes.
before the superintendent leaves, Mr. Superintendent, I forgot to ask this question. Did we ever respond to the Simmons lady that came before us last month concerning that discrepancy in the bus or schedule or pay or whatever? Did she ever get a response
Yes, sir,
from the board?
Yes, sir.
Okay.
Yes, sir.
Thank you, Mr. Hall. Mr. Superintendent, has it been cleared? Has it been resolved?
Good point.
I know we decided
we gave a response, and I've not heard back from it yet.
Okay.
But
Okay.
I'll follow up with that.
Okay.
All right.
Shoot.
Are there any other questions, concerns? At this time, I would like to send my condolences to the Moore family and to the Langford and Cherry. I've known Mr. Cherry for quite some time, when his daughter was a student in my class, and he was working with the transportation department as a very a great parent and a concerned parent. I would also like to thank Vidant Hospital for the masks that were given to the staff, and as I understand, there will be more forthcoming. But I do want to thank them for the masks and for everything that they do to support us in Hertford County, because it seems as if they're always there in support. So thank you very much, Biden Hospital. I would also like to thank Albemarle Regional. They were with us this morning, and they supplied us with a lot of information. They are also with us as we must be time to shut down because the computer's closing up. But I also would like to thank Albemarle Regional, because they always give us quite a bit of information of what is going on and what we're surrounded with. I would like to thank our board. Our board is so dedicated and so caring for our students and families in Hertford County. Sure, we can make quick decisions, but we don't. We study a lot of resources from the health department, from surveys that are given back to us, from data, from media, and wherever we can get, so that we can make our students the best and the healthiest, as I've said, in the nation. Sometimes it takes a while to do that, but remember, parents, staff, everybody, we know that we are all in this together, and our greatest interest is our students and the people in Hertford County. And we will do anything and think of any creative ways for us to get over this mountain. We are in a dark place now, but we, as we always know, we will survive. We will survive. Yeah, I know it takes a toll on families and friends that have to go through a lot, but we as a board, we're doing the very best that we can for every student, every family, every staff and faculty member in Hertford County. I am so glad that Dr. Wright is sending out information so that it will be correct information to our parents and families. And you will be receiving this as soon as possible. I would also like to mention that there will be information sent out to parents of athletes so that you know that you will be a part in this decision making about the practice for our students. Also, we as a board are looking for all rules and policies to be followed once we make our decision about what to do. So I would like to take this opportunity. Dr. Wright, congratulations to you on your chosen field as a superintendent. Congratulations, and we're very proud to have you in Hertford County with us, making these decisions. Our next board meeting is January 25th. And if there aren't any questions, if I've forgotten something, someone please remind me at this time. But I wish every family, every staff, all family of Hertford County Public Schools a very safe, enjoyable holiday. I think we have enough technology where we can Zoom, Mr. Hall, Zoom, and enjoy our families, connect with cameras on TVs as kids open gifts. You know, we just have enough technology, if we have, to enjoy our holidays and not be in the same building together. Because the most important thing is, yes, we miss each other, but the most important thing is to stay safe. And I really want all of you to be safe. Enjoy your family and your friends. And we'll see you in January. So have a great holiday. And thank you so much for all the effort that you have put forth in Hertford County Schools with all the changes we have had to make. But we want to thank you, and we know how dedicated you are. Thank you. Everybody have a good holiday and stay safe. Our next board meeting is January 25th. May I have a motion to adjourn the meeting?
Certainly will.
Second motion.
It has been moved and seconded. The meeting is adjourned. Everybody be safe, and thank you so much.
Thank you. You too.
Thank you, Madam Chair. Madam Chair, we'll be meeting at 10 o'clock the next meeting.
Yes.
Yes.
Okay. All right. Thank you. All right. Everybody have a good holiday.
Yeah.
Thank
everybody